on Monday 8th of March 2021, join the rest of the world to commemorate the International Women's Day, which is observed every 8th of March every year. On this day, government together with stakeholders take stock of the achievements made towards the women's advancement in Uganda. The theme for this year's observance is building on women's strength for a better future in the COVID-19 world. It highlights the effects of COVID-19 on women and girls and seeks to generate a national dialogue on the urgent need for the gender-responsive national COVID-19 response plan to mitigate the impact of the pandemic on women and all communities in Uganda. The theme further highlights the role and the contribution of women in the efforts to manage and also recover from the adverse effects of COVID-19 pandemic. Mind one of the key essentials of life. Whereas government did a noble job to provide food items to households and families, especially in urban areas, there was and there is still continued food supply and production, which has sustained Uganda through these COVID-19 times. It is therefore important to note that women's participation and resilience are crucial in the process of responding and managing crises at all scales. It is on this basis that the government response plan is structured to support the needs of women, including their contribution to the recovery process. The government of Uganda has, through different ministries, departments, and agencies, instituted a number of interventions to strengthen response to the impact of COVID-19 on the population. Some of these interventions include a special COVID-19 subcommittee on gender-based violence and violence against children. It has been put in place, chaired by the Commissioner of Gender and Women's Affairs, to respond to the GBV and violence against children. Government, through the Ministry of Gender, Labour and Social Development and other MDAs, has committed resources, both physical and financial, towards preventing and responding to gender-based violence. Priority interventions include collecting data on gender-based violence through the National Gender-Based Violence Database, operating a toll-free hotline, Sauti 116, to ease reporting of gender-based violence incidents, building capacity of duty bearers to provide services to gender-based violence survivors through training and provision of guidelines and standards and management of gender-based violence shelters. We were able to sustain families throughout the lockdown. The restrictions on use of private cars, public transport, along with curfew, further kept some of the patients at home in the hands of women and girls. This level of resilience, devotion, and significant contribution by women cannot be spoken about lightly. As frontline health workers and caregivers, we have seen women play a key role in fighting against COVID-19. They constitute 70% of the healthcare workers, exposing them to greater risks of infections. The COVID-19 National Preparedness and Response Program needs to recognize and facilitate their specific needs and vulnerabilities. It still remains constant that women comprise 82% of the agricultural workforce, and they continue to produce food items during and post-COVID-19. The judiciary has operationalized special court sessions to handle gender-based violence cases, which make up a large proportion of the case backlogs. The Uganda Police Force has, through the Child and Family Protection Unit and the Sexual and Gender-Based Violence and the Women's Department, enhanced collaboration with investigation crime cases, including gender-based violence cases. Government has continued to invest in flagship socio-economic transformation programs, in particular the Uganda Women Entrepreneurship Program, the social assistance grant for empowerment, for elderly persons with disability grant, the youth livelihood program, Operation Wealth Creation, promotion of saving and credit cooperatives, Emyoga, among others. The Ministry of Gender, Labour and Social Development has sent out guidelines to local government to identify beneficiary groups under WEP and YLP whose operations were affected by the COVID-19 prevention measures. These groups will be refinanced and the repayment of initial loans rescheduled to allow them more time to recover from the income losses they might have incurred during the COVID-19 pandemic. Further funds amounting to 895 million under WEP will be dispensed to support the local government operations, and part of which will be used to carry out the mentioned interventions. Other efforts include mobilizing finances and instituting measures to support health system capacity.